The sterile corridors of Fort Bragg's medical training facility had never seen anything quite like Corporal Maria Santos. While her fellow combat medic trainees gathered around state-of-the-art surgical simulators and computerized patient monitors, Maria sat alone in the corner of the classroom, methodically sharpening a weathered Kabar combat knife that had belonged to her father. The blade's surface bore the patina of years spent in field conditions, its edge honed to surgical precision through countless hours of careful maintenance. Before we jump back in, tell us where you're tuning in from. And if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. "Look at Blade Runner over there," whispered Specialist Jake Morrison, nodding toward Maria's solitary figure. "Does she think we're training for the Stone Age?" His comment drew chuckles from the cluster of trainees who had quickly established themselves as the program's elite. These were the Marines who had scored highest on their medical aptitude tests, who carried the latest tactical medical kits worth thousands of dollars, and who spoke fluently about advanced trauma protocols using equipment that resembled something from a science fiction movie. Maria's dark eyes remained focused on her knife, testing its edge with the practiced motion of someone who understood that a blade's sharpness could mean the difference between life and death. At 26, she was older than most of her classmates, her weathered hands and sun-lined face telling the story of someone who had already seen more combat than many would experience in a full career. Her uniform bore the ribbons of 2 deployments as an infantry marine, including a Purple Heart earned during a firefight in Syria, where she had used that very knife to save 3 wounded Marines when their medical supplies had been destroyed by enemy fire. The Advanced Combat Medical Training Program at Fort Bragg was designed to produce the military's most elite battlefield medics, specialists capable of performing complex medical procedures under fire while maintaining the tactical awareness of seasoned infantry Marines. The 8-week course had a failure rate that exceeded 70%. And those who survived would join the ranks of fewer than 200 active special operations medics worldwide. These were the Marines who would accompany the most dangerous missions, operating far from conventional medical support, where their skills and judgment would determine whether wounded warriors came home alive. Maria's journey to this moment had begun not in a medical school or hospital, but in the backyard of her childhood home in rural New Mexico, where her father, Master Sergeant Roberto Santos, had taught her the fundamentals of field medicine using techniques he had learned during 3 tours in Vietnam. Roberto had been a Navy corpsman before transferring to the Marines, and his reputation for saving lives under impossible conditions had become legendary within the medical community. He had performed amputations with entrenching tools, sutured wounds with paracord, and once famously saved an entire platoon from a biological weapons attack using nothing but activated charcoal and improvised filtration systems. The knife Maria carried had been Roberto's primary medical instrument during his final deployment, where he had earned the Navy Cross for actions that included performing emergency surgery on a wounded Marine using only field-expedient materials while under direct enemy fire. Roberto had understood something that modern military medicine was beginning to forget, that technology could fail, equipment could be lost or destroyed, and in those moments, a medic's true skill lay not in their ability to operate complex machinery, but in their understanding of human anatomy and their willingness to improvise solutions using whatever materials were available. Maria's childhood had been an unconventional medical education, with Roberto teaching her to suture wounds on fruit, to identify medicinal plants in the desert, and to understand the principles of emergency surgery through careful study of anatomy texts and countless hours of practice with basic tools. He had emphasized that the human body was essentially the same, whether you were operating in a state-of-the-art trauma center or a foxhole under enemy fire, and that a medic who truly understood physiological principles could save lives regardless of the equipment available. The other trainees in the program came from backgrounds that emphasized technological sophistication and protocol adherence. They had studied at prestigious medical schools, completed internships at major trauma centers, and were accustomed to working with equipment that could diagnose conditions automatically and provide step-by-step treatment guidance. Their medical kits contained devices that could monitor vital signs remotely, administer medications with computerized precision, and even perform certain surgical procedures through robotic assistance. Specialist Morrison, who had quickly emerged as the unofficial leader of the elite group, carried a medical kit that represented the pinnacle of military medical technology. His equipment included advanced diagnostic tools, computerized drug delivery systems, and surgical instruments that were controlled through digital interfaces. The kit had cost the military over $30,000 and required extensive training to operate effectively. Morrison himself had graduated from Johns Hopkins Medical School before enlisting, and his combination of academic credentials and technological sophistication had made him the program's presumptive standout. Staff Sergeant Jennifer Walsh, the program's senior instructor, had initially been skeptical of Maria's unconventional approach. Walsh was a veteran of multiple deployments where advanced medical technology had saved countless lives, and she understood the value of staying current with the latest innovations in battlefield medicine. However, she also recognized that Maria's background represented a different but equally valid approach to combat medicine, one that emphasized adaptability and resourcefulness over technological dependence. The training scenarios at Fort Bragg were designed to replicate the conditions that special operations medics would face in actual combat situations. The facility included mock battlefields with simulated casualties, environmental challenges ranging from desert heat to Arctic cold, and realistic stressors including simulated enemy fire and equipment failures. Each scenario was crafted to test not only the trainees' medical knowledge, but also their ability to make critical decisions under extreme pressure, while maintaining the tactical awareness necessary for survival in hostile territory. Maria's performance in the early training scenarios had been consistently exceptional, but her methods drew attention and criticism from both instructors and fellow trainees. While other students relied on sophisticated diagnostic equipment to assess casualties, Maria used her hands and eyes to gather the same information through physical examination techniques her father had taught her. Her treatment methods emphasized simple but effective interventions that could be implemented quickly using minimal equipment, an approach that often achieved better outcomes than more complex technological solutions. During one memorable scenario involving multiple casualties from a simulated IED explosion, Maria had treated 4 critically wounded Marines using only basic supplies and her combat knife, while her classmates struggled with malfunctioning equipment and complex protocols. Her patients had been stabilized and evacuated successfully, while other teams were still attempting to diagnose their casualties' conditions using electronic systems that had been damaged by the simulated blast effects. The psychological pressure of the training program was as intense as the medical challenges. Trainees were constantly evaluated on their decision-making abilities, their composure under stress, and their capacity to prioritize multiple competing demands while maintaining focus on their primary mission of saving lives. The instructors, all veterans of multiple combat deployments, understood that the difference between success and failure in battlefield medicine often came down to mental toughness and the ability to function effectively when everything seemed to be going wrong. Maria's approach to handling stress differed significantly from that of her classmates. While they relied on protocols and checklists to maintain structure during chaotic situations, Maria had learned to trust her instincts and adapt her methods to the specific circumstances of each case. Roberto had taught her that medicine was as much art as science, requiring intuition and creativity in addition to technical knowledge. This philosophical difference sometimes put her at odds with instructors who emphasized standardized procedures and protocol compliance. The social dynamics within the training program reflected broader tensions between traditional and modern approaches to military medicine. Morrison and his supporters viewed Maria's methods as outdated and potentially dangerous, arguing that modern warfare required modern solutions and that relying on primitive techniques was unprofessional and irresponsible. They questioned whether her approach would scale effectively to mass casualty events or complex surgical procedures that required precision instrumentation and sterile environments. Maria understood their concerns, but had seen firsthand how technological dependence could become a liability when equipment failed or was unavailable. During her deployments as an infantry marine, she had witnessed medics become helpless when their electronic systems malfunctioned or when they were separated from their advanced medical kits. Roberto's training had prepared her for exactly these situations, teaching her to see opportunities where others saw only obstacles and to find solutions using whatever resources were available. The training program's curriculum covered a broad range of medical scenarios, from routine trauma care to complex surgical procedures that would normally be performed only in hospital settings. Each phase of training built upon previous knowledge while introducing new challenges that tested the trainees' ability to adapt their skills to increasingly difficult situations. The progression was deliberately intense, designed to identify weaknesses early and either correct them or eliminate candidates who could not meet the program's demanding standards. Maria's performance in trauma scenarios was particularly noteworthy, as she demonstrated an ability to assess and treat injuries with a speed and accuracy that impressed even skeptical instructors. Her techniques were unconventional but effective, often achieving better outcomes than students who followed standardized protocols exactly. The knife that had drawn so much criticism from her peers proved to be an exceptionally versatile tool, capable of performing functions that required multiple specialized instruments in conventional medical practice. The weapon maintenance routine that Maria followed each evening became a source of both fascination and mockery among the other trainees. She would carefully disassemble the knife, cleaning each component with the attention to detail that comes from understanding that a tool's reliability could determine whether patients lived or died. The process was meditative for Maria, connecting her to her father's memory and reinforcing the lessons he had taught about the importance of maintaining equipment in perfect working condition. Morrison had made Maria's knife a focal point of his campaign to undermine her credibility within the program. "What happens when she needs to perform microsurgery?" he would ask other trainees. "Is she going to use that thing to repair severed nerves or reattach fingers?" His comments were designed to highlight what he saw as the fundamental inadequacy of Maria's approach, suggesting that her methods might work for basic trauma care but would fail when faced with complex medical challenges requiring precision and sophistication. The instructors maintained professional neutrality in their evaluations, but Maria could sense their growing interest in her unconventional methods. Staff Sergeant Walsh had begun incorporating some of Maria's techniques into her lessons on improvised medical procedures, and Chief Petty Officer Michael Thompson, who taught advanced surgical techniques, had asked Maria to demonstrate her knife-based procedures during several training sessions. The attention was subtle but significant, indicating that experienced medical professionals were beginning to recognize value in approaches that emphasized adaptability over technological dependence. As the program progressed through its initial phases, the challenges became increasingly complex and demanding. Trainees were required to perform medical procedures under simulated combat conditions, with realistic stressors including time pressure, resource limitations, and simulated enemy contact. Maria's training with Roberto had prepared her well for these challenges, as he had always emphasized that real medicine happened under the worst possible conditions, when everything that could go wrong inevitably did. The contrast between Maria's background and that of her fellow trainees became more apparent as the training scenarios increased in difficulty. While they had learned medicine in controlled environments with abundant resources and support systems, Maria had been taught to expect chaos and to find ways to accomplish her mission regardless of obstacles. This difference in preparation was becoming evident in their respective performance levels, as Maria consistently adapted to changing conditions while others struggled with the gap between their classroom training and battlefield realities. The facility's mock operating theaters provided the setting for some of the program's most challenging scenarios, where trainees were required to perform complex surgical procedures under conditions that simulated forward combat zones. These exercises tested not only medical knowledge and surgical skill, but also the ability to maintain sterile techniques and precise motor control while dealing with environmental stressors and time pressure. The scenarios were deliberately designed to push trainees beyond their comfort zones and identify those who possessed the mental toughness required for special operations medicine. Maria's performance in surgical scenarios drew particular attention from instructors and fellow trainees alike. While other students relied on sophisticated surgical instruments and computer-guided systems, Maria demonstrated that many procedures could be performed effectively using simpler tools when handled with appropriate skill and understanding. Her knife, properly sterilized and used with surgical precision, proved capable of tasks that others assumed required specialized equipment worth thousands of dollars. The philosophical divide between Maria's approach and that of her classmates reflected broader changes in military medicine over recent decades. Modern battlefield medical care had become increasingly dependent on technological solutions and standardized protocols, emphasizing equipment sophistication and procedural compliance over individual skill and adaptability. Maria's father had served during an era when medics were expected to improvise solutions using whatever materials were available, when success depended more on understanding fundamental medical principles than on access to advanced technology. Roberto's influence on Maria's medical philosophy extended far beyond technical training to encompass a broader understanding of what it meant to serve as a combat medic. He had taught her that a medic's primary obligation was to preserve life regardless of circumstances, that resourcefulness and determination were more valuable than expensive equipment, and that true medical skill lay in the ability to achieve positive outcomes even when everything seemed stacked against success. These principles had guided Maria's approach throughout her military career and continued to influence her performance in the training program. The training scenarios that followed included mass casualty events designed to test the trainees' ability to perform triage, prioritize treatment decisions, and manage multiple critical patients simultaneously. These exercises were among the most challenging in the program, requiring participants to make life-and-death decisions under extreme time pressure, while maintaining the clinical judgment necessary to maximize the number of lives saved. The scenarios replicated conditions that special operations medics might face during major combat operations or terrorist attacks. Maria's approach to mass casualty management reflected her father's teachings about the importance of rapid assessment and decisive action. While other trainees spent valuable time attempting to diagnose conditions using electronic equipment, Maria used physical examination techniques that provided the same information more quickly and reliably. Her treatment methods emphasized interventions that could be implemented rapidly using minimal resources, allowing her to treat more patients in less time while achieving comparable or better outcomes. The psychological pressure of treating multiple dying patients while knowing that every decision could mean the difference between life and death was intense beyond description. Many trainees struggled with the emotional burden of making choices about who to treat first, who might be saved, and who was beyond help. Maria had learned from Roberto that emotional control was as important as medical knowledge, that a medic who became overwhelmed by the tragedy around them would be unable to function effectively when their skills were most needed. The training program's emphasis on realistic stressors included scenarios where trainees operated under simulated enemy fire, dealt with equipment failures at critical moments, and faced the challenge of treating patients while managing their own safety and that of their team members. These multifaceted challenges tested every aspect of the trainees' preparation, from their technical medical skills to their tactical awareness and leadership abilities under extreme pressure. Maria's performance in these complex scenarios consistently demonstrated the value of her unconventional training and approach. While other trainees became overwhelmed by the multiple demands placed on them, Maria adapted quickly to changing conditions and maintained focus on her primary mission of saving lives. Her ability to improvise solutions using available materials and her comfort with operating in chaotic environments set her apart from classmates who had learned medicine in more controlled settings. The knife that had initially drawn mockery from her peers was proving its worth in scenario after scenario, demonstrating versatility and reliability that expensive electronic medical equipment couldn't match. Roberto had taught Maria that a tool was only as effective as the person using it, and that understanding the principles behind medical procedures was more important than having access to the most sophisticated equipment available. This philosophy was being validated through her consistent success in the program's most demanding challenges. As the training program approached its midpoint, the social dynamics among the trainees had evolved into clear divisions between those who supported Morrison's technology-focused approach and those who were beginning to recognize the value of Maria's methods. The divide reflected broader philosophical differences about the future direction of military medicine and the appropriate balance between technological sophistication and individual skill development. Several trainees had begun asking Maria questions about her techniques during training breaks, curiosity overcoming the peer pressure to maintain distance from her unconventional approach. Corporal Lisa Chen, one of the younger trainees, had started observing Maria's equipment maintenance routine with genuine interest rather than mockery. Staff Sergeant David Park, a quiet professional who had initially been skeptical of Maria's methods, was now incorporating some of her assessment techniques into his own practice. The instructor's evolving attitude toward Maria was perhaps the most significant development since the program's beginning. Their initial skepticism had given way to professional respect, as they recognized that her methods produced consistently excellent results, regardless of the challenges presented. Some were beginning to question whether the military's emphasis on technological solutions had perhaps gone too far, potentially creating medics who were highly skilled at operating equipment, but less capable of adapting when that equipment failed or was unavailable. Staff Sergeant Walsh had begun incorporating Maria's improvisational techniques into the standard curriculum, recognizing that all trainees would benefit from understanding how to achieve medical objectives using minimal resources. The lessons were valuable not only for situations where advanced equipment was unavailable, but also for developing the kind of fundamental understanding that made medics more effective even when sophisticated tools were accessible. Preparing and narrating this story took us a lot of time, So if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story. Chief Petty Officer Thompson had taken a particular interest in Maria's surgical techniques, asking her to demonstrate procedures during evening training sessions that were attended by instructors as well as trainees. These informal demonstrations revealed the depth of Maria's knowledge and the sophistication of techniques that appeared simple on the surface but required extensive understanding of anatomy and physiology to execute safely and effectively. The program's academic components included extensive study of anatomy, physiology, pharmacology, and advanced trauma management techniques. Maria's performance in written examinations was consistently excellent, demonstrating that her practical skills were supported by thorough theoretical knowledge. Her test scores often exceeded those of trainees who had attended prestigious medical schools, indicating that Roberto's unconventional teaching methods had provided her with a comprehensive medical education that rivaled formal academic programs. The combination of practical skill, theoretical knowledge, and proven performance under pressure was establishing Maria as one of the program's standout candidates, despite the initial skepticism about her methods. Her success was forcing both instructors and fellow trainees to reconsider their assumptions about the relationship between technological sophistication and medical effectiveness, opening discussions about the appropriate balance between innovation and proven techniques in military medicine. The training scenarios that marked the program's transition into its final phase included the most challenging and realistic exercises yet encountered. These scenarios were designed to test every skill the trainees had developed, while introducing new stressors that would push them to their absolute limits. The exercises would determine who among them possessed not only the technical knowledge and practical skills required for special operations medicine, but also the mental toughness and adaptability that defined elite military medical professionals. Maria's preparation for these final challenges involved the same methodical approach that had characterized her performance throughout the program. She continued her evening equipment maintenance routine, ensuring that her knife remained in perfect condition for whatever challenges lay ahead. The blade that had once been a source of mockery had become a symbol of excellence, representing an approach to medicine that emphasized fundamental principles over technological dependence and adaptability over protocol compliance. The weight of carrying forward her father's legacy was something Maria felt intensely as she prepared for the program's culminating challenges. Roberto's reputation within the military medical community had been built on his ability to save lives under the most impossible conditions, and Maria understood that her performance would be judged not only on its own merits, but also as a reflection of the training and philosophy he had passed down to her. The responsibility was both motivating and daunting, driving her to achieve excellence while creating pressure that could potentially interfere with her performance. As Maria sat in her quarters on the evening before the final evaluation phase, she reflected on the journey that had brought her to this moment. The path had been marked by skepticism and isolation, but it had also been guided by the wisdom and experience of a man who had understood that true medical skill transcended technological innovation. Roberto's influence continued to shape her approach, providing confidence that the principles he had taught her would prove their worth in the ultimate test that awaited with the rising sun. The pre-dawn darkness at Fort Bragg carried an unusual weight, as Maria made her way to the equipment preparation area, where her father's knife waited alongside the basic medical supplies that would comprise her entire kit for the final evaluation. 7 weeks of intensive training had led to this moment, and the results of the previous day's written examination had confirmed what everyone already suspected. Maria's academic performance was among the top 3 in the program, proving that her practical skills were supported by comprehensive theoretical knowledge that rivaled the best medical school graduates. The final evaluation exercise was designed to be the most comprehensive test in military medical training, a scenario that would push the remaining candidates beyond anything they had previously experienced. The exercise would unfold over 72 hours in a remote training area that replicated conditions from multiple theaters of operation, complete with realistic casualties, environmental challenges, and tactical constraints that would test every aspect of the trainees' preparation. Chief Petty Officer Thompson stood before the assembled candidates in the briefing room, his expression conveying the gravity of what lay ahead. "Ladies and gentlemen," he began, his voice carrying the authority earned through multiple combat deployments as a special operations medic. "What you're about to undertake represents the ultimate test of your medical training and tactical competence. This exercise will determine who among you has what it takes to serve as a special operations combat medic." The silence in the room was absolute, As the 12 remaining candidates absorbed the magnitude of the moment, each understood that their military careers and the lives of future patients depended on their performance over the next 3 days. Thompson gestured toward a large tactical map displayed behind him, indicating various locations marked with different symbols and colors. You will be inserted into a 30-square-mile training area that includes urban, rural, and wilderness environments, Thompson continued. Throughout this area, you will encounter casualties representing the full spectrum of combat injuries, from routine trauma to complex medical emergencies requiring immediate surgical intervention. Your mission is to provide appropriate treatment for each casualty while maintaining tactical awareness and avoiding detection by opposing forces. The complexity of the scenario was immediately apparent. Unlike previous training exercises that had focused on specific aspects of combat medicine, this final test would require simultaneous management of medical, tactical, and logistical challenges while operating with minimal support and resources. Each candidate would be responsible for making critical decisions about patient care priorities, resource allocation, and risk management while dealing with the stress of simulated combat conditions. Each casualty encounter will be evaluated based on your assessment accuracy, treatment appropriateness, and overall patient outcome, Thompson explained. You will have access only to the medical supplies you can carry, and resupply opportunities will be limited and unpredictable. Equipment failures, resource shortages, and environmental challenges are integral parts of this exercise, designed to test your ability to adapt and improvise when standard solutions are unavailable. Maria felt her confidence grow as she absorbed the details of the challenge. This was exactly the type of scenario where Roberto's training would provide maximum advantage. The emphasis on adaptability, resource management, and improvisational problem-solving played directly to her strengths, while potentially exposing weaknesses in candidates who had become overly dependent on sophisticated equipment and standardized protocols. Specialist Morrison raised his hand, his expression reflecting confidence despite the daunting nature of the challenge ahead. Chief, what about communication protocols with higher medical authority? Will we have access to telemedicine consultations for complex cases? Thompson's slight smile suggested he had expected this question from someone accustomed to working with extensive support systems. Specialist Morrison, you will operate under the assumption that you are the highest medical authority available to your casualties, Thompson replied. Communication systems may be compromised, consultation resources unavailable, and evacuation impossible. You will succeed or fail based on your own knowledge, skills, and judgment. The briefing continued with specific details about the exercise's scoring system, safety protocols, and rules of engagement that would govern interactions with both casualties and opposing forces. The evaluation criteria were comprehensive, covering not only medical outcomes but also tactical awareness, resource management, and leadership under pressure. Success would require excellence across multiple dimensions rather than competence in any single area. Maria took careful notes as Thompson outlined the types of casualties they could expect to encounter. The scenarios included everything from routine combat injuries to complex medical emergencies that would normally require hospital-level resources. Some cases would test their ability to perform life-saving procedures under time pressure, while others would challenge their judgment about when aggressive treatment was appropriate versus when to focus resources on patients with better survival prospects. The equipment inspection that followed the briefing revealed the stark differences in approach that had characterized the program from its beginning. Morrison's medical kit represented the pinnacle of military medical technology, containing advanced diagnostic devices, computerized drug delivery systems, and surgical instruments that required electronic control systems to operate effectively. The kit's total weight approached the maximum allowable limit, but its capabilities were impressive enough to handle virtually any medical scenario under ideal conditions. Maria's equipment load was dramatically different from her peers' high-tech arsenals. Her primary tools consisted of her father's combat knife, basic medical supplies, and simple instruments that had proven reliable under field conditions for decades. The knife dominated her kit both physically and symbolically, its weathered appearance contrasting sharply with the gleaming sophistication of her classmates' equipment. Roberto had taught her that reliability was more valuable than capability when lives hung in the balance. Corporal Chen approached Maria during the equipment inspection, curiosity evident in her expression. Santos, I have to ask, are you really planning to handle complex medical cases with just that knife and basic supplies? Some of these scenarios are going to require surgical procedures that need precision instrumentation. Maria tested the edge of her blade with practiced motion, noting the perfect sharpness that would be essential for the challenges ahead. "Chen, I've been using this knife to save lives for 3 years," Maria replied calmly. "It's performed every procedure I've needed, from simple suturing to complex trauma surgery. The key isn't having the most sophisticated tools, it's understanding how to use whatever you have effectively." Staff Sergeant Park overheard the conversation and joined in, shaking his head in continued disbelief, despite having witnessed Maria's capabilities firsthand. "I respect your performance in training, Maria, but this is different," Park said. "We're talking about life and death decisions with limited resources and no backup support. Advanced medical procedures require advanced medical equipment, especially when there's no room for error." Maria listened politely but said nothing, understanding that her response would come through performance rather than argument. The pre-mission briefing included weather forecasts that confirmed challenging conditions throughout the exercise period. A low-pressure system was moving through the region, bringing intermittent rain, temperature fluctuations, and wind conditions that would complicate both medical procedures and tactical movement. The environmental challenges were intentional, designed to test the candidate's ability to maintain medical effectiveness when operating conditions were far from ideal. Maria had experienced similar weather conditions during her combat deployments, and she understood that her equipment would function reliably regardless of environmental factors. The combat knife had been designed for use under the harshest conditions imaginable, and Roberto's training had prepared her to perform medical procedures effectively even when visibility was poor and working surfaces were unstable. The simplicity of her approach became an advantage when complex systems might fail due to environmental interference. The psychological preparation for the final evaluation was as important as the technical aspects. The exercise was designed to create stress levels that approached actual combat conditions, testing not only the candidate's medical knowledge, but also their ability to make sound decisions when exhausted, overwhelmed, and operating under extreme pressure. Roberto had taught Maria that mental toughness was as crucial as technical skill, that a medic who remained calm and focused under the worst conditions could achieve outcomes that seemed impossible to outside observers. The final equipment check revealed that Maria would be carrying significantly less weight than most of her classmates, a factor that would affect her mobility and endurance throughout the extended exercise. While others struggled with packs approaching the maximum allowable weight due to their sophisticated equipment loads, Maria's streamlined kit would allow her to move more quickly between casualty locations and maintain energy reserves for demanding medical procedures. Thompson gathered the candidates for final instructions as the sun began to set over the training area. "You have until 05:00 hours to complete your final preparations," he announced. "Transportation to insertion points will begin at 05:30, and the exercise will commence at dawn. Remember that your performance over the next 72 hours will determine not only your success in this program, but also your future opportunities within the Special Operations medical community." The evening preparation period was marked by intense focus and nervous energy as each candidate made final adjustments to their equipment and reviewed their approach to the challenges ahead. Maria spent time studying anatomical references and reviewing surgical techniques, ensuring that her theoretical knowledge was perfectly aligned with the practical skills she would need to demonstrate. Roberto had always emphasized that preparation was the foundation of success, that thorough understanding of fundamental principles would enable improvisation and adaptation when unexpected situations arose. Morrison and his supporters gathered in one corner of the preparation area, sharing equipment checks and discussing tactical approaches in hushed tones. Their conversation occasionally included predictions about Maria's likely failure when faced with complex cases requiring sophisticated intervention. The comments reflected their continued belief that modern medicine required modern solutions, that technical challenges demanded technological responses rather than improvisational techniques. Maria ignored the commentary, focusing instead on her own preparation and the mental conditioning techniques Roberto had taught her for maintaining concentration under extreme stress. The ability to remain calm and focused when everything seemed to be falling apart was perhaps the most valuable skill a combat medic could possess, more important than any piece of equipment or memorized protocol. The meditation techniques Roberto had shared with Maria were based on his own experiences dealing with overwhelming trauma and impossible decisions during combat operations. He had learned that emotional control was essential for effective decision-making, that a medic who became paralyzed by the horror around them would be unable to function when their skills were most desperately needed. These mental preparation methods had served Maria well throughout her deployments and would be crucial for success in the final evaluation. As the night progressed, Maria methodically reviewed her equipment one final time, following a routine that had become second nature through years of practice. Each component was inspected for proper function, backup plans were considered for potential equipment failures, and procedures were mentally rehearsed to ensure smooth execution under pressure. The process was both practical and psychological, providing confidence that she was as prepared as possible for whatever challenges the exercise might present. The other candidates were making similar preparations, but Maria noticed that many seemed overwhelmed by the complexity of their equipment systems. Modern military medical gear offered tremendous capabilities, but it also required extensive knowledge and maintenance to function properly. The sophistication that was supposed to provide advantages could become a liability when operators became dependent on systems they didn't fully understand or couldn't repair when problems arose. Thompson's voice cut through the preparation area as he announced the final call for rest. Lights out in 30 minutes. Get whatever sleep you can. Tomorrow begins 72 hours that will test everything you've learned and determine who among you has what it takes to be a special operations combat medic. Maria nodded, understanding that the next few hours of rest would be crucial for her performance in the days ahead, but also knowing that her confidence came not from her equipment, but from the training her father had provided and the principles he had instilled in her approach to medicine under the most challenging conditions imaginable. The first casualty Maria encountered was positioned in what appeared to be the aftermath of a vehicle-borne improvised explosive device attack. The simulated blast site included realistic debris, smoke effects, and multiple casualties with varying degrees of injuries that would test her ability to perform rapid triage under chaotic conditions. The scenario was designed to replicate the type of mass casualty event that special operations medics might encounter during urban combat operations, where quick decision-making and efficient resource allocation could mean the difference between saving multiple lives and losing them all. Maria approached the scene with the methodical assessment technique Roberto had drilled into her during their countless training sessions in the New Mexico desert. Rather than rushing to the most obviously injured casualty, she took 30 seconds to survey the entire situation, identifying all casualties, assessing the tactical environment, and determining the best approach for maximizing positive outcomes. The technique was counterintuitive to many medics who felt compelled to immediately begin treating the most severely wounded, but Roberto had taught her that proper triage required understanding the complete picture before committing resources to any individual patient. The primary casualty was a simulated Marine with massive trauma to his lower extremities, arterial bleeding, that would prove fatal within minutes without immediate intervention. Traditional triage protocols would classify him as the highest priority case, requiring immediate surgical intervention using advanced medical equipment and extensive resources. However, Maria's assessment revealed that 2 other casualties had survivable injuries that could be treated quickly using minimal resources, allowing her to save 3 lives instead of potentially losing all of them while focusing on the most critically wounded patient. Maria's decision to begin with the less severely injured casualties drew immediate criticism from the exercise evaluators who were monitoring her performance. "Santos, you're ignoring the priority casualty," called Staff Sergeant Rodriguez, one of the senior instructors observing the scenario. "That Marine is going to bleed out while you're treating minor injuries." Maria continued her work without looking up, applying pressure dressings to a simulated chest wound while simultaneously directing the walking wounded to assist with casualty evacuation. "Sergeant, the priority casualty has injuries that will require surgical intervention and extensive resources that I don't have available," Maria replied calmly while moving to her second patient. "I can save 3 lives by treating the survivable cases first, then focus my remaining resources on determining what's possible for the critical patient." Her approach reflected Roberto's teaching that combat medicine was about maximizing the number of lives saved, rather than making heroic but ultimately futile efforts to save patients who were beyond help given available resources. The second casualty presented with penetrating abdominal trauma that would normally require immediate surgical exploration in a hospital setting. However, Maria's assessment revealed that the wound trajectory had likely missed major organs and vessels, making it treatable with field-expedient techniques that could stabilize the patient for evacuation. She used her combat knife to carefully enlarge the wound opening, allowing proper visualization of internal structures before beginning a repair procedure that combined traditional surgical principles with improvised techniques her father had developed in Vietnam. The procedure Maria performed was technically complex, requiring precise anatomical knowledge and sophisticated manual dexterity despite using relatively simple tools. She identified and ligated several small bleeding vessels using suture material from her basic medical kit, cleaned and inspected the wound tract for foreign debris, and created a layered closure that would maintain tissue integrity during evacuation. The entire procedure took 18 minutes to complete, significantly faster than similar interventions performed by her classmates using advanced surgical equipment during previous training scenarios. Exercise evaluators documenting Maria's performance noted the efficiency and effectiveness of her improvised surgical technique, but several questioned whether her approach met the standards of care expected from special operations medics. "Santos is certainly getting results," observed Chief Petty Officer Williams, one of the senior medical instructors, "but she's essentially performing surgery with a knife and basic supplies. What happens when she encounters complications that require specialized instruments or monitoring equipment?" The third casualty in the mass casualty scenario presented with traumatic brain injury and decreased level of consciousness, a condition that would normally require advanced neurological assessment and monitoring equipment to manage appropriately. Maria's evaluation revealed signs consistent with increased intracranial pressure, a life-threatening condition that required immediate intervention to prevent permanent disability or death. Traditional treatment protocols called for sophisticated monitoring devices and pharmaceutical interventions that were not available in her basic medical kit. Maria's approach to managing the brain-injured casualty drew upon techniques Roberto had learned during his service in Vietnam, where neurological trauma was common, but advanced monitoring equipment was non-existent. She used clinical observation skills to assess the patient's neurological status, monitoring pupil response, motor function, and respiratory patterns to gauge the severity of intracranial pressure elevation. Her treatment involved positioning techniques and basic pharmacological interventions that could reduce pressure without requiring sophisticated equipment or monitoring systems. The improvised neurological management technique Maria employed was controversial among the evaluating instructors, who questioned whether field-expedient methods could provide adequate care for such complex injuries. However, her patient's condition stabilized significantly during the treatment period, demonstrating that traditional clinical skills could achieve positive outcomes even when advanced technology was unavailable. The success of her intervention forced the evaluators to reconsider their assumptions about the relationship between technological sophistication and medical effectiveness. By the time Maria reached the priority casualty with massive lower extremity trauma, she had successfully treated 3 other patients and gained valuable information about available resources and tactical constraints. Her assessment of the critical patient revealed that the arterial bleeding could be controlled using tourniquet techniques, but that definitive repair of the vascular injury would require surgical capabilities beyond what could be achieved with field-expedient methods. However, Roberto's training had taught her that stabilization for evacuation was often more appropriate than attempting procedures that exceeded available resources. Maria's hemorrhage control technique for the critical casualty involved multiple tourniquets applied in a sequence that controlled bleeding while maintaining some circulation to viable tissue. She used her combat knife to perform a limited surgical exploration of the wound, identifying the specific vessels that were damaged and determining which could be repaired using available materials. The procedure required exceptional anatomical knowledge and surgical skill, but Maria's training had prepared her for exactly these types of challenging interventions under resource-constrained conditions. The tourniquets Maria applied were positioned based on her understanding of vascular anatomy rather than standard protocol recommendations, allowing her to control hemorrhage while preserving circulation to tissue that might otherwise be lost due to ischemia. Her approach reflected Roberto's teaching that medical procedures should be tailored to specific patient needs rather than following rigid protocols that might not address unique circumstances. The technique was successful in stabilizing the patient, but it also demonstrated surgical thinking that impressed the evaluating instructors. The completion of the mass casualty scenario had taken Maria 4 hours and resulted in successful stabilization of all casualties despite resource limitations that would have challenged even hospital-based medical teams. Her performance demonstrated that traditional medical skills, properly applied, could achieve excellent outcomes under conditions where technological solutions were unavailable or impractical. The success of her improvised techniques was forcing both instructors and fellow candidates to reconsider their assumptions about modern battlefield medicine. The second major scenario Maria encountered was designed to test her ability to perform complex medical procedures under direct enemy fire, simulating conditions where special operations medics might need to provide life-saving care while maintaining tactical awareness and personal survival. The scenario included realistic small arms fire effects, explosive devices, and environmental stressors that would challenge her ability to maintain focus on medical procedures while remaining alert to tactical threats. The casualty in this scenario was a simulated special operations soldier with penetrating chest trauma that had resulted in tension pneumothorax, a condition that would prove fatal within minutes without immediate intervention. The injury required a procedure called needle thoracostomy, which involved inserting a large bore needle into the chest cavity to relieve pressure that was preventing normal lung function. The procedure was technically straightforward, but required precise anatomical knowledge and steady hands, particularly when performed under fire. Traditional medical protocols for tension pneumothorax called for specialized equipment, including large gauge needles, chest tubes, and monitoring devices that could assess the effectiveness of the intervention. Maria's basic medical kit included the necessary needles, but she lacked the sophisticated drainage systems and monitoring equipment that were standard for this type of procedure. However, Roberto's training had prepared her for exactly these situations, teaching her to improvise drainage systems using available materials and to assess treatment effectiveness through clinical observation rather than electronic monitoring. Maria's approach to the chest decompression procedure demonstrated the kind of tactical medicine that Roberto had pioneered during his combat service. She positioned herself in the casualty to minimize exposure to enemy fire while maintaining access to the patient's chest, used natural cover to shield her work area, and performed the procedure with the smooth efficiency that came from understanding both the medical and tactical aspects of combat casualty care. The entire intervention was completed in less than 3 minutes despite the challenging conditions. The improvised drainage system Maria created for managing the pneumothorax used materials from her basic medical kit, combined with field-expedient components that provided effective chest decompression without requiring specialized medical equipment. Roberto had taught her that the principles of physiology remained the same regardless of available tools, and that understanding these principles allowed medics to achieve necessary outcomes using whatever resources were accessible. Her drainage system was simple but effective, providing adequate pressure relief while remaining durable under field conditions. The patient's response to Maria's intervention was immediate and dramatic, with rapid improvement in respiratory status and overall clinical condition that confirmed the success of her improvised procedure. Exercise evaluators monitoring the scenario noted the speed and effectiveness of her technique, but several questioned whether field-expedient methods provided adequate safety margins for such critical procedures. The debate reflected broader tensions within military medicine about balancing technological sophistication with practical adaptability. The tactical aspects of the scenario continued to evolve as Maria worked, with simulated enemy forces maneuvering to interdict her position while she attempted to complete patient care and arrange for evacuation. The multidimensional challenge tested her ability to integrate medical knowledge with tactical awareness, demonstrating skills that were essential for special operations medics but often overlooked in traditional medical training programs. Roberto had understood that combat medics operated in a unique environment, where clinical excellence and tactical competence were equally important for mission success. Maria's patient movement technique under fire drew upon training Roberto had provided, based on his experiences evacuating casualties through hostile territory during his Vietnam deployments. She used tactical movement principles to relocate her patient to a more secure position while maintaining continuity of care, demonstrating that medical treatment and tactical operations could be integrated seamlessly when proper training and preparation had been provided. The technique was complex and demanding, requiring simultaneous attention to medical and tactical considerations. The evacuation sequence that concluded the scenario tested Maria's ability to transfer patient care to higher-level medical assets while providing appropriate medical information and maintaining patient stability during transport. Her casualty had been successfully stabilized using field-expedient techniques, but the receiving medical team questioned whether her improvised interventions were appropriate preparation for more definitive care. The discussion revealed philosophical differences about the role of forward medical care and its relationship to hospital-based treatment protocols. Maria's documentation of her interventions was thorough and professional, demonstrating that her unconventional techniques were based on sound medical principles rather than random improvisation. Roberto had taught her that proper record-keeping was essential for continuity of care and professional accountability, especially when using non-standard procedures that might not be familiar to receiving medical personnel. Her documentation included detailed descriptions of her assessment findings, treatment rationale, and patient response that would allow follow-on medical teams to understand and build upon her interventions. The third major scenario Maria encountered was designed to test her ability to perform emergency surgery under field conditions, using minimal equipment and no external support. The challenge was positioned as the most demanding medical task in the evaluation, requiring not only advanced surgical skills, but also the judgment to determine when aggressive intervention was appropriate versus when to focus on stabilization and evacuation. The scenario would separate candidates who possess true surgical capability from those who were only competent at following standard protocols. The casualty was a simulated Marine with penetrating abdominal trauma that had resulted in significant internal bleeding and potential damage to vital organs. Initial assessment revealed signs consistent with liver laceration and possible bowel perforation, injuries that would normally require immediate surgical exploration in an operating room environment with full surgical teams and specialized equipment. The challenge was to determine what level of intervention was possible under field conditions and whether attempting surgery would improve or worsen the patient's chances of survival. Maria's surgical assessment of the abdominal trauma case drew upon everything Roberto had taught her about emergency surgery under resource-constrained conditions. She began with careful external examination of the wound, using her hands and eyes to gather information about the likely trajectory of the penetrating object and the internal structures that might have been damaged. Her assessment technique was methodical and comprehensive, providing detailed information about the patient's condition without requiring sophisticated diagnostic equipment. The decision to proceed with surgical exploration was one of the most critical Maria would face during the entire evaluation. Roberto had taught her that emergency surgery in the field required different risk-benefit calculations than hospital-based procedures, that the medic had to consider not only what was medically possible, but also what was tactically feasible given available resources and evacuation timelines. The decision-making process involved complex medical, tactical, and ethical considerations that tested every aspect of her training. Maria's preparation for the emergency surgical procedure involved creating an improvised operating environment using available materials and environmental resources. She identified a sheltered area that provided adequate lighting and protection from environmental factors, assembled her surgical instruments including her father's combat knife, and established sterile technique protocols that would minimize infection risk while accommodating field conditions. The preparation process demonstrated the kind of adaptive thinking that Roberto had emphasized throughout her training. The surgical exploration Maria performed was technically demanding, requiring precise anatomical knowledge and sophisticated manual dexterity, despite the resource limitations of the field environment. She used her combat knife to create a controlled surgical incision that provided adequate visualization of internal structures while minimizing additional trauma to the patient. The incision placement and technique demonstrated surgical training that exceeded what most combat medics possessed, reflecting the comprehensive education Roberto had provided. The liver laceration Maria identified during her surgical exploration was significant but repairable using techniques that could be accomplished with her available equipment. Roberto had taught her that liver injuries often appeared more severe than they actually were, that proper surgical technique could control bleeding and repair tissue damage without requiring the specialized equipment available in hospital settings. Her approach to the liver repair demonstrated both surgical skill and the kind of practical wisdom that came from understanding when aggressive intervention was appropriate. The bowel injury Maria discovered during her exploration presented more complex challenges, requiring careful assessment of tissue viability and decisions about repair versus resection techniques. Roberto's training had included extensive instruction on gastrointestinal surgery, recognizing that penetrating trauma often involved multiple organ systems and that combat medics needed to be prepared for complex repairs. Her approach to the bowel injury demonstrated surgical thinking that impressed even skeptical evaluators who had questioned her unconventional methods. The surgical closure technique Maria employed for the abdominal incision involved multiple tissue layers and suture patterns that would provide adequate wound healing while accommodating the physiological stresses of patient transport and ongoing medical care. Roberto had emphasized that surgical closures needed to be appropriate for the environment where healing would occur, that field repairs needed to be more robust than hospital procedures because follow-up care might be delayed or unavailable. Her closure technique reflected this understanding. The complete surgical procedure took Maria nearly 3 hours to complete, during which time she maintained patient stability through careful monitoring of vital signs and fluid balance, using clinical assessment techniques rather than electronic monitoring systems. The successful completion of major abdominal surgery using only basic equipment and a combat knife represented an achievement that challenged fundamental assumptions about the requirements for surgical intervention in combat environments. The patient's recovery from Maria's surgical intervention was rapid and uncomplicated, demonstrating that her field-expedient techniques had achieved the intended therapeutic goals without causing additional complications. Exercise evaluators documenting the procedure noted the sophistication of her surgical approach and the excellent clinical outcomes, but several continued to question whether such complex interventions were appropriate for medics operating without surgical backup and specialized equipment. The debate reflected ongoing tensions about the appropriate scope of practice for combat medics. The fourth scenario Maria encountered tested her ability to manage multiple casualties with complex medical conditions while operating under significant time pressure and resource constraints. The challenge was designed to simulate conditions during major combat operations where medical assets might be overwhelmed by casualty volume and where difficult decisions about resource allocation would determine overall outcomes. The scenario required not only medical expertise, but also leadership skills and ethical judgment about prioritizing care when resources were insufficient to treat everyone optimally. The mass casualty scenario included 8 simulated casualties, with injuries ranging from minor trauma to immediately life-threatening conditions that required immediate intervention. Maria's approach to the complex triage situation drew upon principles Roberto had taught her about maximizing survival rates through efficient resource allocation, rather than attempting to provide optimal care for individual patients. The philosophy was challenging for many medics to accept, but it represented reality for combat medical operations, where resources were always limited relative to needs. Maria's triage assessment of the multiple casualties was completed in less than 10 minutes, during which time she performed rapid but thorough evaluations of each patient and made preliminary decisions about treatment priorities and resource allocation. Her assessment technique was efficient and systematic, gathering essential information about each casualty's condition while avoiding unnecessary procedures that would consume time and materials without significantly affecting treatment decisions. The approach demonstrated the kind of clinical efficiency that Roberto had emphasized as essential for mass casualty management. The treatment sequence Maria developed for managing the multiple casualties reflected sophisticated understanding of medical priorities, resource constraints, and logistical considerations that would affect overall outcomes. She identified 3 patients who could be treated rapidly using minimal resources, 2 who required more intensive intervention but had good survival prospects, 2 who could be stabilized with basic care pending evacuation, and 1 whose injuries exceeded what could be treated effectively under current conditions. The prioritization was clinically sound but emotionally challenging. The first group of casualties Maria treated included patients with bleeding that could be controlled using pressure dressings and tourniquets, fractures that could be stabilized using improvised splinting techniques, and shock that could be managed with positioning and basic fluid resuscitation. These interventions required minimal time and resources while achieving significant improvement in patient outcomes, allowing Maria to rapidly improve the overall situation before focusing on more complex cases. The approach demonstrated efficient resource utilization. The second group of casualties presented more challenging medical conditions that required more sophisticated interventions, but still remained within the scope of what could be accomplished using Maria's available equipment and training. These cases included penetrating trauma that required surgical exploration, respiratory compromise that needed airway management, and neurological injuries that required careful assessment and monitoring. The treatments were more time-consuming but still achievable within the resource constraints of the scenario. Maria's surgical management of the complex casualties in the mass casualty scenario required rapid decision-making about the extent of intervention that was appropriate, given the overall situation. She performed limited surgical procedures that achieved essential therapeutic goals without consuming resources that were needed for other patients, demonstrating the kind of surgical judgment that Roberto had emphasized as crucial for combat medicine. The approach required balancing individual patient needs with overall mission requirements. The two casualties Maria classified as suitable for basic stabilization pending evacuation represented patients whose conditions exceeded what could be treated definitively under current conditions but who could potentially benefit from higher-level care if evacuation was possible. Her approach to these cases involved interventions that would maximize their survival prospects during transport while not consuming resources that were needed for more treatable patients. The decisions required both medical knowledge and ethical judgment about resource allocation. The most challenging aspect of the mass casualty scenario was Maria's management of the casualty, whose injuries exceeded what could be treated effectively under available conditions. Roberto's training had prepared her for these situations, teaching her that combat medics sometimes faced impossible decisions about resource allocation when demand exceeded available capabilities. Her approach to this casualty focused on comfort care and pain management while ensuring that resources remained available for patients who could potentially be saved. The completion of the mass casualty scenario demonstrated Maria's ability to manage complex medical situations while maintaining both clinical effectiveness and leadership presence under extreme pressure. Her overall success rate exceeded 90% for the survivable casualties, while her resource utilization was more efficient than any other candidate had achieved in similar scenarios. The performance validated Roberto's teaching that combat medicine was fundamentally about maximizing positive outcomes, rather than following standardized protocols regardless of circumstances. The psychological impact of managing multiple critically injured casualties while making difficult decisions about resource allocation was significant, but Maria's mental preparation had equipped her to maintain clinical focus and emotional stability throughout the challenging scenario. Roberto had taught her that emotional control was as important as technical skill for combat medics, that the ability to function effectively in traumatic situations was what separated truly capable medics from those who were only competent under controlled conditions. The fifth and most challenging scenario Maria encountered was designed to test her ability to perform life-saving medical procedures while operating completely alone in hostile territory, with no possibility of external support or evacuation assistance. The scenario replicated conditions that special operations medics might face during deep reconnaissance missions, or after being separated from their units during combat operations. Success would require not only exceptional medical skills, but also the mental toughness to function effectively under isolation and extreme pressure. The casualty in this final scenario was a simulated special operations soldier, with multiple penetrating wounds, including damage to major blood vessels, respiratory compromise from chest trauma, and suspected internal injuries that would require surgical exploration to assess and treat appropriately. The combination of injuries was severe enough that survival would be unlikely without immediate and skilled medical intervention, but complex enough that treatment would require every aspect of Maria's training and experience. Maria's initial assessment of the complex trauma case revealed the full scope of the medical challenge she faced. The patient had sustained what appeared to be multiple gunshot wounds with entrance and exit wounds that suggested high-velocity projectiles had caused significant tissue damage throughout the torso. Her assessment indicated damage to major blood vessels, possible cardiac involvement, definite pulmonary trauma, and probable intra-abdominal injuries that could include liver, spleen, or bowel damage. The case represented the most complex medical challenge of her career. The decision-making process for managing such complex trauma required Maria to rapidly prioritize interventions based on immediate life threats, while developing a comprehensive treatment plan that could address all of the patient's injuries using only her available equipment. Roberto's training had prepared her for exactly these situations, teaching her to think systematically about trauma management while remaining flexible enough to adapt to changing conditions and unexpected complications that might arise during treatment. The hemorrhage control challenge was the most immediate threat to the patient's survival, with bleeding from multiple sites that needed to be addressed simultaneously to prevent exsanguination. Maria's approach involved a combination of direct pressure, tourniquets, and surgical techniques that could control bleeding from both external wounds and internal injuries. Her combat knife became the primary tool for achieving surgical access to damaged vessels, while her basic medical supplies provided the materials needed for vascular repair. The respiratory management aspect of the case required Maria to address both external chest wounds and internal injuries that were compromising lung function. She used her knife to perform surgical procedures that relieved pressure on the lungs while creating drainage systems that could remove blood and air from the chest cavity. The techniques were complex and technically demanding, requiring precise anatomical knowledge and steady hands despite the pressure of knowing that any mistake could prove fatal. The surgical exploration of the abdominal injuries represented the most challenging aspect of the entire case, requiring Maria to perform major surgery using only field-expedient techniques and basic equipment. Roberto's training had included extensive instruction on emergency abdominal surgery, recognizing that penetrating trauma often required immediate surgical intervention to control bleeding and repair damaged organs. Maria's approach demonstrated surgical skills that exceeded what most combat medics possessed. The liver injuries Maria discovered during her surgical exploration were extensive, involving multiple lacerations that were actively bleeding and requiring immediate repair to prevent fatal hemorrhage. Her repair technique involved careful identification of damaged blood vessels, followed by precise suturing that could control bleeding while preserving tissue viability. The procedures required exceptional manual dexterity and anatomical knowledge, but Roberto's training had prepared her for exactly these challenges. The discovery of splenic damage during Maria's surgical exploration presented additional challenges, as the spleen's vascular nature made it particularly prone to uncontrollable bleeding when injured. Traditional medical doctrine often called for spleen removal in cases of significant trauma, but Roberto had taught Maria techniques for splenic repair that could preserve organ function while controlling hemorrhage. Her approach to the splenic injury demonstrated surgical innovation that impressed even skeptical evaluators. The bowel injuries Maria identified required careful assessment of tissue viability and decisions about repair versus resection techniques that could be accomplished under field conditions. Roberto had emphasized that gastrointestinal repairs needed to be particularly robust when performed under field conditions, as complications from bowel injuries could prove fatal even when initial repairs appeared successful. Maria's approach to the bowel injuries reflected this understanding. The complete surgical procedure required nearly 5 hours to accomplish, during which time Maria maintained patient stability through careful monitoring and fluid management, using only clinical assessment techniques and basic supportive care measures. The successful completion of such complex surgery, using only a combat knife and basic medical supplies, represented an achievement that challenged fundamental assumptions about the requirements for major surgical intervention. The patient's recovery from Maria's comprehensive surgical intervention was remarkable, demonstrating that her field-expedient techniques had successfully addressed all of the life-threatening injuries while maintaining physiological stability throughout the procedure. The case had tested every aspect of her medical training while requiring the kind of mental toughness and adaptability that Roberto had identified as essential characteristics for combat medics operating under extreme conditions. Exercise evaluators documenting Maria's performance throughout the complex trauma case noted not only the technical excellence of her surgical procedures, but also the calm professionalism she maintained throughout the challenging intervention. Her ability to function effectively under extreme pressure, while performing procedures that would challenge hospital-based surgical teams, demonstrated the kind of capability that defined elite special operations medical personnel. The psychological impact of successfully managing such a complex case while operating completely alone was significant for Maria, validating years of training and preparation while confirming that Roberto's unconventional teaching methods had equipped her with capabilities that exceeded even her own expectations. The success of the intervention represented not only personal achievement, but also validation of training principles that emphasized adaptability and fundamental understanding over technological dependence. The completion of the final scenario marked the end of Maria's participation in the most comprehensive medical evaluation in military training, having demonstrated capabilities that exceeded the performance of candidates using the most sophisticated medical equipment available. Her success with basic tools and traditional techniques had proven that medical excellence transcended technological advantages when supported by comprehensive training and unwavering dedication to saving lives under any conditions. The dawn light filtering through the medical facility's windows cast long shadows across the debriefing room where Maria sat with her father's combat knife resting on the table before her. 72 hours of the most intensive medical evaluation in military history had concluded, and the results were about to be announced to the 12 candidates who had survived the complete program. The knife's weathered surface reflected the fluorescent lights above, its battle-scarred appearance telling the story of 3 generations of military medical service that had culminated in this moment of ultimate validation. Chief Petty Officer Thompson stood at the front of the room with a stack of evaluation folders, his expression revealing nothing about the outcomes that would determine each candidate's future in special operations medicine. The silence was profound, as the assembled Marines waited to learn which among them had achieved the standards necessary to earn the coveted Special Operations Medical Badge. Thompson's gaze moved slowly across the room, acknowledging each candidate before beginning the formal presentation of results. "Ladies and gentlemen," Thompson began, his voice carrying the weight of authority earned through multiple combat deployments and years of training the military's most elite medical personnel. "What you have completed over the past 8 weeks represents the most comprehensive evaluation of combat medical capability in the United States military. The standards you have been held to exceed those of civilian medical residency programs, while incorporating tactical and environmental challenges that have no equivalent in civilian medicine." Maria felt her pulse quicken as she absorbed Thompson's words, understanding that the next few minutes would determine not only her professional future, but also the validation of training methods that her father had developed decades earlier. The combat knife that had drawn so much skepticism from her peers had proven itself in scenario after scenario, demonstrating that fundamental medical principles could achieve extraordinary outcomes when applied with skill and determination. "The evaluation criteria for this program are deliberately comprehensive," Thompson continued, "encompassing not only medical knowledge and technical proficiency, but also leadership under pressure, adaptability to challenging conditions, and the mental toughness required to function effectively when lives depend on split-second decisions. The scenarios you have completed were designed by subject matter experts who understand the realities of special operations medical support in contemporary conflict environments." The tension in the room was palpable as Thompson opened the first evaluation folder, preparing to announce results that would separate the successful candidates from those who had not met the program's demanding standards. Maria's thoughts turned to Roberto and the countless hours they had spent in the New Mexico desert, where he had taught her that medicine was fundamentally about preserving life regardless of circumstances or available resources. His philosophy had guided her through every challenge of the training program. "Specialist Morrison," Thompson announced, reading from the first folder. "Your performance demonstrated strong academic knowledge and proficiency with advanced medical equipment. However, your adaptability to resource-constrained environments and ability to improvise solutions when standard equipment was unavailable fell below the standards required for special operations medical personnel. You will be returned to your parent unit with recommendations for continued development in conventional medical roles." Morrison's face reflected shock and disappointment as he processed the news of his elimination from the program. His sophisticated medical equipment and prestigious educational background had not provided the adaptability and fundamental understanding that proved essential when technological solutions were unavailable. The announcement validated Maria's approach while demonstrating that academic credentials and expensive equipment could not substitute for practical competence under challenging conditions. "Corporal Chen," Thompson continued, "your performance showed significant improvement throughout the program, particularly in your ability to adapt treatment methods to available resources. However, your decision-making under extreme pressure and leadership during mass casualty scenarios require further development before you can be certified for special operations medical assignments. You will be retained for additional training with potential for program completion pending demonstrated improvement in identified areas." Chen's retention for additional training represented a middle ground between outright failure and complete success, acknowledging her potential while recognizing that some capabilities required further development. Her growing interest in Maria's techniques during the program had reflected genuine curiosity about alternative approaches to combat medicine, suggesting that exposure to different methodologies could enhance her overall effectiveness. "Staff Sergeant Park," Thompson announced, consulting the next folder, "your performance demonstrated excellent technical proficiency and strong leadership capabilities throughout the evaluation period. Your ability to integrate advanced medical procedures with tactical awareness meets the standards required for special operations medical personnel. Congratulations, you have successfully completed the Advanced Combat Medical Training Program." Park's success represented validation of a more conventional approach to special operations medicine, demonstrating that candidates could succeed using standard equipment and protocols when they possessed the necessary knowledge, skills, and mental toughness. His achievement also reflected his willingness to learn from alternative approaches, as he had incorporated some of Maria's techniques into his own practice during the later phases of training. The announcements continued through the remaining candidates, with roughly half achieving successful completion while others were eliminated or retained for additional training. The results reflected the program's deliberately high standards, and its commitment to ensuring that only the most capable candidates earn certification as special operations medics. Each announcement provided insight into the specific strengths and weaknesses that had determined individual outcomes. "Corporal Santos," Thompson finally announced, his voice carrying a subtle shift in tone that suggested something significant was about to be revealed. "Your performance throughout this program has been exceptional in ways that have challenged our fundamental assumptions about combat medicine and the relationship between technological sophistication and medical effectiveness. Your successful completion of complex medical procedures using minimal equipment while maintaining superior patient outcomes has demonstrated capabilities that exceed our highest expectations." Maria felt a surge of emotion as she heard Thompson's words, understanding that her father's legacy was being formally recognized and validated by the military's most experienced medical professionals. The combat knife that had once been dismissed as obsolete had proven itself capable of achieving medical outcomes that rivaled or exceeded those produced by the most sophisticated equipment available. "Your approach to combat medicine represents a synthesis of traditional fundamental principles with innovative adaptation that has proven effective under the most challenging conditions," Thompson continued. "The techniques you have demonstrated will be incorporated into our standard curriculum to ensure that future special operations medics possess the adaptability and resourcefulness that your training has exemplified. Congratulations, you have not only successfully completed this program, but have also distinguished yourself as the honor graduate." The announcement of Maria's selection as honor graduate sent a wave of surprise through the assembled candidates, many of whom had initially dismissed her unconventional approach as unsuitable for modern military medicine. Her achievement represented more than individual success. It validated training methods that emphasized fundamental understanding over technological dependence, and demonstrated that excellence could be achieved through dedication to proven principles, rather than reliance on expensive equipment. Thompson's presentation included specific details about Maria's performance that highlighted the exceptional nature of her achievement. Her success rate in treating casualties had exceeded 95% across all scenarios, significantly higher than the program average. Her resource utilization had been more efficient than any candidate in the program's history, while her surgical outcomes had met or exceeded hospital standards despite being achieved under field conditions using basic equipment. The combat knife that Corporal Santos carried throughout this program has become a symbol of the fundamental principles that define excellence in special operations medicine, Thompson noted, gesturing toward the weathered blade resting on the table. This weapon, which served her father with distinction during multiple combat deployments, has demonstrated that superior outcomes result from superior training and understanding, rather than superior equipment. The ceremony that followed Thompson's announcements included the formal presentation of Special Operations medical badges to the successful candidates, but Maria's recognition carried additional significance as the first graduate to achieve honor status using traditional equipment and techniques. Her achievement represented a paradigm shift in military medical thinking, demonstrating that innovation could come from rediscovering and refining proven methods, rather than solely from technological advancement. Staff Sergeant Walsh, the program's senior instructor, approached Maria following the formal ceremony with an expression that reflected both professional respect and personal admiration. "Santos, your performance has been remarkable, but I think there's something you should know about the broader impact of what you've accomplished here," Walsh said, her voice carrying the weight of someone who understood the significance of historical moments. "Your techniques and philosophy are being studied by medical professionals throughout the Department of Defense," Walsh continued. "The success you've achieved using traditional methods has prompted a comprehensive review of our training protocols and equipment procurement policies. You've demonstrated that we may have become too dependent on technological solutions at the expense of developing the fundamental skills that define medical excellence." The conversation with Walsh revealed the extent to which Maria's achievement was influencing military medical policy at the highest levels. Her demonstration that superior outcomes could be achieved using simple tools and proven techniques had challenged assumptions that had guided military medical procurement and training for decades. The implications extended far beyond individual success to encompass broader questions about the appropriate balance between innovation and tradition in military medicine. Dr. Sarah Mitchell, the program's chief medical officer, had requested a private meeting with Maria to discuss the research and documentation aspects of her achievement. Mitchell was a civilian physician with extensive experience in trauma surgery who served as a consultant to multiple special operations medical programs. Her interest in Maria's techniques reflected recognition from the broader medical community that the innovations demonstrated during the training program had applications beyond military settings. Corporal Santos, Dr. Mitchell began as they met in her office overlooking the training facility. "Your performance has been extraordinary, but what makes it truly significant is the systematic nature of your approach. You haven't just improvised solutions. You've demonstrated a complete methodology for achieving medical excellence under resource-constrained conditions. We'd like to document these techniques to ensure they can be preserved and taught to future generations of military medics." The documentation project that Dr. Mitchell proposed would involve creating comprehensive training materials based on Roberto's techniques as refined and demonstrated by Maria during the program. The materials would include detailed procedural descriptions, training progressions, and case studies that could be used to teach Maria's methods to other medical personnel. The project represented formal recognition that her father's innovations deserved preservation and dissemination within the military medical community. Your father's techniques represent a complete approach to combat medicine that integrates surgical skills, tactical awareness, and psychological preparation in ways that are rarely seen in modern military medicine, Dr. Mitchell explained. The training materials we create based on your demonstration will help ensure that these capabilities are available to future special operations medics who may face similar challenges in resource-constrained environments. The research component of the documentation project would involve detailed analysis of Maria's patient outcomes compared to those achieved by candidates using conventional equipment and techniques. Preliminary analysis suggested that her approach not only matched conventional methods in terms of medical outcomes, but actually exceeded them in several key areas, including speed of intervention, resource efficiency, and patient satisfaction measures. Commander James Harrison, the overall director of Special Operations Medical Training, had scheduled a meeting with Maria to discuss her future assignment options and the potential for her to serve as an instructor in the program she had just completed. Harrison was a Navy physician who had served in multiple combat deployments and understood the value of the capabilities Maria had demonstrated during her training. "Santos, your achievement here represents more than exceptional individual performance," Commander Harrison noted as they met in his office. "You've demonstrated a complete approach to special operations medicine that we need to preserve and integrate into our standard training protocols. I'd like to offer you the opportunity to serve as an instructor here, where you can pass these techniques on to future generations of special operations medics." The instructor position that Commander Harrison offered would involve developing curriculum based on Roberto's techniques while serving as a senior trainer for future classes of special operations medical candidates. The role would allow Maria to directly influence the training of hundreds of medics over the course of her assignment, while ensuring that her father's innovations became a permanent part of military medical education. "Your father's legacy deserves to be preserved and transmitted to others who can benefit from his innovations," Harrison continued. "The techniques you've demonstrated during this program represent capabilities that could save countless lives if they're properly integrated into our training protocols. You've proven that excellence in medicine transcends technological advancement and depends fundamentally on understanding, skill, and dedication to saving lives." The assignment offer represented not only professional recognition, but also the opportunity to fulfill Roberto's vision of sharing knowledge and techniques that could benefit other military medical personnel. Maria understood that accepting the position would allow her to honor her father's memory while ensuring that his contributions to military medicine would continue to influence future generations of combat medics. The impact of Maria's achievement extended beyond the immediate training program to influence broader discussions about military medical policy and procurement priorities. Senior leaders throughout the Department of Defense were reviewing the implications of her success for equipment acquisition, training methodologies, and personnel development strategies. The questions raised by her performance were fundamental. Had military medicine become too dependent on expensive technological solutions? Were traditional skills being neglected in favor of equipment-based capabilities that might not be available when most needed? General Patricia Williams, the Army's Surgeon General, had requested a briefing on Maria's techniques and their potential applications across military medical specialties. The briefing would involve demonstration of key procedures, discussion of training requirements, and analysis of resource implications for implementing Maria's methods on a broader scale. The request reflected recognition at the highest levels that Maria's achievement represented more than individual excellence. The techniques demonstrated by Corporal Santos challenge our fundamental assumptions about the requirements for medical excellence in combat environments, General Williams noted in her request for the briefing. If these methods can be validated and scaled across our medical personnel, they could represent significant improvements in both capability and cost-effectiveness for military medical operations. The validation studies that would be required to implement Maria's techniques on a broader scale would involve controlled comparisons between traditional methods and conventional approaches across multiple scenarios and patient populations. The studies would need to demonstrate not only that Maria's techniques were effective when used by her, but also that they could be taught to other medical personnel with comparable results. Dr. Robert Chen, the Director of Military Medical Research, had begun preliminary planning for comprehensive studies that would evaluate the effectiveness of Roberto's techniques when implemented by medics with varying levels of experience and training backgrounds. The studies would represent the most comprehensive evaluation of traditional combat medicine techniques ever undertaken by the military medical establishment. The preliminary data from Santos's performance suggests that these traditional techniques may actually be superior to conventional methods in several important areas, Dr. Chen noted in his initial research proposal. However, we need systematic evaluation to determine whether these results can be replicated by other personnel and whether the techniques can be effectively integrated into our standard training curricula. The research program that Dr. Chen proposed would involve multiple phases of evaluation, beginning with detailed analysis of Maria's documented procedures and outcomes, followed by controlled training studies with volunteer subjects, and culminating in field evaluation exercises that would test the techniques under realistic operational conditions. The comprehensive approach would ensure that any policy changes based on Maria's achievement were supported by rigorous scientific evidence. The international implications of Maria's success were also becoming apparent, as allied military medical organizations expressed interest in learning about the techniques she had demonstrated. Representatives from NATO Medical Commands, Australian Defence Force Medical Services, and other allied organizations had requested information about Roberto's methods and their potential applications for their own medical personnel. Colonel Sarah Thompson from the British Army Medical Corps had submitted a formal request for training exchange opportunities that would allow British medics to learn Maria's techniques while sharing their own innovations with American personnel. The request reflected recognition that Maria's achievement represented knowledge that could benefit military medical personnel across international boundaries. The techniques demonstrated by your Corporal Santos represent exactly the kind of adaptable, resource-efficient medical capabilities that our personnel need for operations in austere environments, Colonel Thompson noted in her exchange request. We believe that sharing these innovations across allied medical services would enhance the capabilities of all our forces, while strengthening the relationships between our medical communities. The legacy aspects of Maria's achievement were perhaps the most personally significant for her, as they represented the fulfillment of Roberto's vision for preserving and transmitting knowledge that could save lives under the most challenging conditions. The formal recognition of his contributions to military medicine represented vindication of training methods that had been developed through combat experience rather than academic study. The memorial tribute that the Special Operations medical community planned for Roberto would acknowledge his innovations and their continued relevance for contemporary military medicine. The tribute would include establishment of an annual award recognizing excellence in adaptive medicine and resourceful problem-solving under challenging conditions. Maria's achievement had provided the catalyst for formal recognition of her father's contributions to military medical practice. Master Sergeant Roberto Santos represents the best traditions of military medicine, noted the citation being prepared for the memorial tribute. His innovations in combat medical care, preserved and demonstrated by his daughter, continue to save lives and influence medical practice decades after his service. The techniques he developed represent a complete approach to medical excellence that transcends technological limitations and emphasizes the fundamental principles that define outstanding patient care. The training materials being developed based on Maria's demonstration would be titled the Santos Method in recognition of Roberto's contributions and Maria's role in validating and refining his techniques. The materials would become standard references for special operations medical training and would be made available to military medical personnel throughout the Department of Defense. Maria's reflection on her achievement encompassed not only personal satisfaction but also recognition of the broader implications for military medicine and the preservation of traditional knowledge in an increasingly technological world. Her success had demonstrated that innovation could come from rediscovering and refining proven methods rather than solely from developing new technologies. The lesson was applicable far beyond military medicine to encompass any field where technological advancement was being pursued without adequate consideration of fundamental principles. The knife that had carried Maria through the most challenging evaluation in military medical training would be displayed in the Special Operations Medical Museum as a symbol of the enduring value of traditional skills and fundamental understanding. The display would include Roberto's service record, documentation of the techniques he developed, and analysis of their continued relevance for contemporary military medicine. 6 months after her graduation from the Advanced Combat Medical Training Program, Staff Sergeant Maria Santos stood before a new class of Special Operations medical candidates at the training facility where her own journey had been validated. Her father's combat knife rested in its place of honor on the instructor's desk, its weathered appearance telling the story of 3 generations of military medical service while symbolizing the enduring value of fundamental principles over technological sophistication. The classroom filled with 36 candidates from across the military services, each having earned their place through exceptional medical performance and demonstrated leadership potential. Maria surveyed the assembled medics, noting the mixture of confidence, nervousness, and determination that characterized every new class. Some carried sophisticated medical equipment worth thousands of dollars, while others had opted for simpler approaches that emphasized versatility and reliability over technological complexity. "Welcome to the Advanced Combat Medical Training Program," Maria began, her voice carrying the authority earned through combat experience and validated through exceptional performance. "Over the next 8 weeks, you will be challenged to demonstrate not only your medical knowledge and technical proficiency, but also your ability to adapt, improvise, and achieve excellence when standard solutions are unavailable or inadequate." The training philosophy that Maria brought to her instructor role emphasized the integration of traditional and modern approaches to combat medicine, recognizing that both technological innovation and fundamental principles had important roles in achieving medical excellence. Her curriculum incorporated advanced medical equipment and techniques, while ensuring that students developed the adaptability and resourcefulness that would serve them when sophisticated systems were unavailable. "The knife you see on this desk belonged to my father, Master Sergeant Roberto Santos, who used it to save hundreds of lives during multiple combat deployments," Maria explained to the class. "This weapon represents more than just a tool. It symbolizes the principle that medical excellence depends on understanding, skill, and dedication, rather than expensive equipment. Your success in this program will be determined not by the sophistication of your equipment, but by your ability to use whatever tools are available to preserve life and restore health." The students who graduated from Maria's program carried with them not only advanced medical skills, but also an appreciation for the fundamental principles that transcended technological change. Their success in operational assignments provided ongoing validation of the training methods that had been passed down through 3 generations of military medical service, ensuring that Roberto's legacy would continue to influence military medicine for decades to come. The impact of Maria's achievement extended throughout the special operations medical community, inspiring other medical personnel to question their assumptions about the relationship between technological sophistication and medical effectiveness. Her success had demonstrated that excellence could be achieved through dedication to proven principles, encouraging a new generation of military medics to pursue fundamental understanding rather than relying solely on equipment-based solutions. The annual Roberto Santos Award for Excellence in Adaptive Medicine became one of the most prestigious recognitions in military medical service, acknowledging personnel who demonstrated exceptional ability to achieve medical objectives under resource-constrained conditions. The award criteria reflected the principles that had guided Roberto's innovations and Maria's demonstration of their continued relevance. The story of Maria's triumph had become part of military medical tradition, inspiring countless medics to pursue excellence through fundamental competence rather than technological dependence. Her achievement proved that individual determination and family legacy could overcome any obstacle when supported by proper preparation and unwavering commitment to saving lives under any conditions. The training facility that had witnessed Maria's validation of traditional medical principles continued to produce special operations medics who carried forward the lessons she had demonstrated. The integration of Roberto's techniques into standard curricula ensured that future generations of military medical personnel would possess the adaptability and resourcefulness that had defined excellence in combat medicine since its earliest days. As Maria continued her service as a senior instructor and developer of military medical training protocols, she remained guided by the principles Roberto had taught her during their desert training sessions years earlier. The knife he had carried through multiple wars continued to serve as both a practical tool and a symbol of the enduring value of fundamental knowledge, skilled application, and unwavering dedication to the preservation of life. The legacy that began with a World War II combat medic in the Pacific Theater and continued through his daughter's validation of his techniques would inspire military medical personnel for generations to come. Roberto's innovations had proven their worth in contemporary combat environments, demonstrating that true medical excellence transcended technological change and remained rooted in the fundamental principles of understanding human physiology, adapting to challenging conditions, and maintaining absolute commitment to saving lives regardless of circumstances. Years later, when Maria received letters from medics serving in combat zones around the world, describing how Roberto's techniques had helped them save lives when sophisticated equipment failed or was unavailable, she understood the full significance of what had been accomplished. The knowledge that had been passed from father to daughter and then shared with countless others had fulfilled its ultimate purpose: preserving life and restoring health under the most challenging conditions imaginable. The combat knife that had once been dismissed as obsolete had become an icon of medical excellence, representing the principle that true capability came from understanding and skill rather than expensive equipment. Roberto's legacy lived on not only in the techniques that bore his name, but also in the philosophy that guided their application, that medicine was fundamentally about preserving life, and that excellence in that mission could be achieved regardless of available resources when guided by proper training, clear thinking, and unwavering dedication to the highest standards of patient care. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.